The ECG sensor and electrodes. Using the correct electrode and good electrode positioning have a positive effect on the ECG quality. Wrong placement or use of old or dried-out electrodes may result in increased artifacts. On the clip, you will find two different color codes. The one closer to the cable is the European code. On the outside of the clip, you will see the US color code. The patient preparation. If necessary, remove any hair from the patient's chest in the area where the electrodes shall be placed. It is recommended to prepare the patient's skin. The use of the skin prep gel will clean the skin surface and enhance conductivity. This will decrease the risk to get artifacts. Do not use alcoholic solutions to clean the skin. Alcohol reduces the skin's conductivity and will have a negative impact on the ECG quality. EasyPad L. Use the hole in the middle of the pad and aim for the patient's nipple. EasyPad S. Place the EasyPad S in the middle of the baby's chest. EasyPad 4. Draw an imaginary horizontal line between the nipples of the patient. Place 2 of the single electrodes around 2 fingers wide, above that line, and 2 fingers wide below that line on the left side of the chest. Connect the ECG sensor to the ECG electrode. Have a look at your ECG curve and see if you get a good signal on the display. If necessary, adapt the amplitude to get a signal higher than 1 millivolt. The default ECG lead is 2. If lead 2 does not give you a good signal, try lead 1 or 3. ECG monitoring during MRI examination. During the scanning procedure, you might see artifacts on the ECG line. This can happen depending on MRI sequences and patients' physiological conditions, or even from scanner vibrations. If artifacts occur, try to change the ECG lead. This might help to minimize artifacts. You may also change the ECG filter. It is always helpful to reduce the impact of vibrations on the ECG sensor. Place the ECG pod on top of the patient, or if placed next to the patient, put a towel or a blanket under it. At the end of the examination, do not forget to put the ECG sensor back to the charging bracket. Insert the sensor with the cable pointing downwards to full stop. The 3 LEDs on the sensor pod will start flashing. In parking position, connect the main monitor to mains power to make sure that monitor and sensor batteries are always charged.